Hey guys, welcome back to our channel, The Upper Hand. So in the last few videos we've been covering standardized assessments, and today we're going to be talking about Semmes Weinstein Monofilament Testing.
Yeah guys, so we're just going to talk about, number one, what is it, two, how to administer it, and three, how to read it, as well as uncover a few mistakes that some practitioners may be making, and we just want to find out ways to avoid those mistakes. So first, what is it? So Semmes Weinstein Monofilament Testing is exactly what it says. It's monofilament testing, and what we use this for is to test the presence of cutaneous sensation. So this assessment tool consists of typically about 5 different monofilaments that vary in thickness. So again, this is kind of what we're going to use to measure or assess someone's sensory loss. And I do think it's important to note that this is a subjective test. Just keep that in the back of your mind, and we'll talk about that a little bit later in the video. So the first thing you want to make sure is that your patient is resting on a stable surface. We typically have them on this elevation pad here. When administering this test, you're going to occlude their vision with a case, or either just have them close their eyes. But before I do that, I always like to show them, what this is, and sometimes it can look kind of scary. It's just a little, almost like a little fishing line. It's very thin and it's not painful at all. So what I'll do is either kind of show the patient on the other hand, or sometimes I'll just come up and kind of touch their arm or other part of their hand, just to show them that this is non-invasive, this is not going to be painful. So again, I think that's important to do before you get started. So with our testing kit, 2.83 is our lowest gauge, and that is considered normal sensation in the hand. So we always start with the lowest number, 283, and then if he doesn't feel that one, we will then kind of work our way up the line. But again, you always want to start with the lowest one. So let's talk about how to do this. So again, their vision is going to be occluded. I'm going to ask Dylan to close his eyes, and as I'm having them close their eyes, I always make sure to tell the patient that I need them to say yes or touch when they feel something, because if they just shake their head yes, I'm always looking down at the patient, so I may not see that. So I make sure that that's explained to them before I do the test. So Dylan, if you could just say yes whenever you feel something, okay? We're going to just start at a random finger. When you're testing this, you want the monofilament hitting the finger at about a 90-degree angle, okay? You don't want to come here at this angle, because then it could kind of scrape them, and that's just going to mess your assessment up. So make sure it's at a 90-degree angle, and with anything below a 4.08 monofilament, you can tap the patient up to 3 times, and you can even hold it for approximately 1 or 2 seconds while you're doing that. So say I'm doing it with a 283 on his index finger.
Yes. Yes. Yes.
Okay, and so you go through each finger. Let's just say, for instance, he did not feel the 283 on his ring finger. So I'm touching here on the radial aspect of his ring finger. He does not feel that. He felt all of the other ones. Put that down and get my next gauge up, which is going to be a 3.61. And then repeat that same step. And I may not go straight to that area. I may start here and then work my way over there, and then administer that test again to see if he happens to feel this larger gauge. Okay, so say that he feels that one. It's also important to test the opposite side of the finger, because with your digits you're going to have a radial digital nerve and an ulnar digital nerve, and that becomes extremely important when you get to the ring finger, because it is innervated by 2 different nerves. The radial half is innervated by the median nerve. The ulnar half is innervated by the ulnar nerve. So that's very important to note during your assessment. You make sure you want to assess both sides, especially if the patient has some type of carpal tunnel or cubital tunnel going on. Just for the purpose of this video, I'm going to go ahead and do a 6.65, which is the largest gauge that we have for the hand or digits. say I'm going to push the patient. Now watch this. This is a lot larger gauge monofilament. So if I'm pushing down, you can see the patient's finger moving. So when you're doing something this large, you want to make sure that they are completely stable and that their hand is resting. So again, if you start pushing down and their finger moves, that's going to give them proprioceptive input, which they may be able to feel, since that's not a cutaneous sensation that we're testing. So again, they're completely still. You're pushing down, holding for a second or two, and lift it off. Okay, and you can even see that making his finger blanch some. So if they don't feel the 6.65 gauge monofilament, that just means that they are completely asensate in that area, and you would certainly suspect some type of digital nerve laceration or some type of peripheral nerve pathology. All right, and one other thing, quick thing I wanted to mention, earlier we said this is a subjective test, and that's true. We are relying on the patient to give us the feedback. Now, if someone is wanting to give submaximal effort, this would be an easy test for them to do that on, because we have no way of assessing that validity. Or do we? So like I said, it's a subjective test. There are ways that patients can linger or just not give their best effort with this assessment. So a few ways that we can try to test for validity there. Say someone is saying that they have no sensation in their median nerve distribution. They've had a carpal tunnel surgery, and they're saying that they can't feel anything in the thumb, index, or middle finger, half of the ring. And you've performed your Semmes Weinstein monofilament test, and you're on the 6.65, and they're saying they just cannot feel that. So one thing you can do is continue to perform that test, but you can grab like a paper clip and perform a sharp dull test on them. A lot of times that will kind of make them jump because they're not expecting that. That will let you know that they are in fact feeling something. Another way, less invasive way, that you can perform a type of validity assessment on sensation is to perform some type of stereognosis assessment with them. So like I've got in front of me a penny, a bead, a little pom-pom looking ball, a little green triangle, a dice, just things that are different sizes and shapes. You can have that patient's vision completely occluded, so have their hand in something where they cannot see at all, and then you're going to watch them as they grab the objects and move it to the other side of whatever you have in front of them. So what a patient would do if they truly had no sensation in their median nerve distribution, they would not be able to feel when they find something, they would not be able to feel that. So what they would do is kind of grab with they would have to find it with their small finger, because that's innervated by the ulnar nerve. So a lot of times people will end up grabbing like a palmar grasp on an object versus grabbing with a pincer grasp like we normally do. So again, a normal way someone would pick this up would be to use their thumb and index, or even thumb, index, and middle. So again, if patients are kind of fumbling around and they finally find something, and if they ended up picking it up with their thumb and index and middle fingers and move it across, then that tells you that they have at least some sensation in there. Otherwise, they would not be able to feel that they're picking that up. Hey guys, thank you so much for taking time out of your day to watch this video. We hope you learned something today and that this was helpful to you in some way.
So our goal for this channel, The Upper Hand, is to give you guys the upper hand as you seek to better understand conditions of the upper extremity and just all topics related to occupational therapy in general.
So please take a second out of your day, make sure you like this video and subscribe to this channel so that you can be sure that you're going to see all of our upcoming videos. Thank you guys so much, and we'll see you next time.